Lesson 3. How does CPR affect the body? A CPR Proficient Guide. The information provided on CPR Proficient's website is for educational purposes only and should not be considered medical advice. While we strive to provide accurate and up-to-date information, CPR Proficient makes no representations or warranties of any kind, express or implied, about the completeness, accuracy, reliability, suitability, or availability of the information, products, services, or related graphics contained on this website for any purpose. Any reliance you place on such information is therefore strictly at your own risk. As stated in Lessons 1 and 2, CPR primarily affects the cardiovascular and respiratory systems, or the heart and lungs. Remember, the cardio in CPR refers to the cardiovascular system, while pulmonary refers to the respiratory system. Well, here's the truth about CPR. Despite common beliefs, it often ends in death, with potential complications. Only about 1 in 5 patients actually survive the procedure. CPR also almost always leads to broken bones, and the physiological stress of the procedure can cause neurological problems. While not intended, broken ribs are some of the most common consequences of CPR. The force and frequency of compressions can cause ribs to audibly snap, crackle, and pop. Bruising around the sternum is also almost guaranteed. Furthermore, older patients or those with conditions that cause lower bone density are more prone to having the ribs broken. Although it is possible for the ribs to break, it does not happen every time CPR is administered, and it is not the main goal of the procedure. About 30% of individuals who survive the procedure end up with broken ribs. Regardless of whether the patient's ribs break, it is important to continue administering CPR. Remember, life is always over limb. Other than the ribs breaking, there are two main complications associated with CPR: neurological deficits and vomiting/aspiration. Hypoxia due to respiratory arrest can cause irreversible brain damage. About 1/3 of all CPR patients face some kind of neurological deficit after being resuscitated. In terms of vomiting, when providing artificial ventilation, air may enter the stomach and cause distension. This is when the stomach expands due to air entering it. This frequently results in aspiration or vomiting, and these fluids may enter the lungs and cause further complication through pneumonia. This vomit can also block the airway, and if not cleared immediately, it could block your ability to ventilate the patient. There are two main factors that influence patient outcome: age and any underlying health conditions they may have. After the age of 60, the success rate of CPR drops by about 5%. Older patients are also more prone to face other complications during CPR, which can reduce post-resuscitation survival rates. Furthermore, people with underlying health conditions have a lower survival rate after receiving CPR. Cancer, COVID-19, and other illnesses which impact the cardiovascular or respiratory systems can nearly halve the chances of surviving the procedure. The survival rates listed above are recorded from in-hospital accounts of sudden cardiac arrest. It shows the relationship between age and the percentage of patients surviving until they're discharged from the hospital. On average, only around 20% of victims survive. In adults ranging from 70 to 79 years of age, this then drops down to 18%. In patients ranging from 80 to 89 years of age, this drops down to 15%, and in patients over the age of 90, the survival rate is only 12%. Universally, the setting matters. Hospital survival rates are around 15%, while nursing homes have only around 1 to 2% of patients survive after receiving CPR. Also, the timing matters. Survival rates decrease with the delayed initiation. Within 3 to 5 minutes, about half patients may survive, while after 12 minutes, only around 5% of them will. The table on the left shows how different illnesses can impact the effectiveness of CPR. Those that impact vital organ function, specifically respiratory or cardiovascular function, significantly lower the chances of resuscitation. Only about 7% of patients with cancer survive after CPR, and only about 3% of patients with COVID-19 survive after receiving CPR. Thank you for completing Lesson 3 of CPR Proficient's CPR Guidebook. Please move on to Lesson 4.